Today's speaker is J.D. McCoy, NMD. J.D. McCoy, NMD, received his doctorate in naturopathic medicine at the Canadian College of Naturopathic Medicine. He completed an internship in internal medicine in Hawaii and then began specialized training, certification, and externship in cosmetic medicine and light-based therapies. Dr. McCoy has devoted his specialization, passion, and entire practice to the art of less invasive cosmetic rejuvenation, weight management, and natural bioidentical hormone therapy since 2003. He is the first naturopathic physician to attain membership in the American Academy of Cosmetic Surgery, is a speaker and trainer for many medical aesthetic manufacturers, and additionally holds advisory board positions for several of those same manufacturers. And with that, I'll let you take it away. Thanks, Dr. McCoy.
Thank you very much. It's great to be with everybody today. And I'm especially excited because I'm getting to talk about something that I use in the practice, my technicians use in the practice every single day. And I can say sincerely, it would be very difficult for me to do the work that I'm currently doing without some of the devices and techniques that I'm going to describe today. And the title is perfect here when we say acoustic wave therapy updates for treatment and financial success. To me, the amazing treatment breeds the ground to have financial success. But at the end of the day, we have bills to pay, we have equipment to pay for. So any little tip or pearl that I can provide to help make you financially successful is checking the box for me. Just gonna go forward. Sorry. So I do have a few disclosures. None are directly related to the talk today, but the take home is really simple. The products and devices that I get to use every single day tend to be the things that I speak about sincerely. So I'm blessed in that I get to work with a lot of the manufacturers, boots on the ground, doing clinical studies, and getting to relay some of the clinical experience and bring that to life, hopefully for you guys today, and when I get the opportunity to teach, train, or speak on the podium. So this is what it's all about today. Blast from the past, right? So it's not all just about this, but it really goes to the history and roots of Zimmer for myself, and for many people, I think, is when we go back to Vanilla Ice and we think of Ice Ice Baby, we're thinking about the Zimmer chiller. And when it comes to the Zimmer chiller, it was revolutionary in the practice, and it's still revolutionary in my practice. And I'm sure that many people have experience and exposure, but it's kind of like the idea of using ice packs and different things to try to cool the skin, and the evolution of having a device that we could use to chill, not only chill the skin, but do it in a really effective way, a more comfortable way, enhancing the patient experience so that they get a better outcome, enhancing safety, and at the end of the day, creating the gold standard for chilling technology. And we use this device every single day, whether I'm doing a halo, whether we're doing a BBL, photofacial, whether we're doing something that's involving any kind of heat or discomfort, having a tool that we can make something more comfortable, again, that is a win-win. So it's one of those things I want to keep that evolution going, and Zimmer has done that. And in many ways, because today we're going to be focusing on acoustic wave therapy and looking at their Z-Wave device. So we've got the Z-Wave Pro, which I've been using for many years, over 5 years. I've done millions of pulses with this device, millions. And now I've been using the new Z-Wave Q, which we'll talk about. But again, what I would say is, in a different way, this is an evolution of a technology that is indispensable for me in my practice. And I'll explain why, but it very much in the same way as the Zimmer chiller, meaning that would be something I wouldn't want to give up, and I would have a difficult time giving up in the practice, because it makes such a big difference as far as patient result, patient comfort, and outcome. And those are all like high priority day after day, every single patient that walks in the door, whether I'm treating their face or their body. So for those that aren't familiar with Z-Wave, with the idea of using acoustic waves, what we're dealing with is a radial wave, and this is a sound wave that is mechanical. And I'll show you some imagery that kind of helps illustrate it. But there's really two main types of acoustic waves that can be used medically. Focused high energy waves, which are used in things like lithotripsy, so where it's strong enough and high energy enough that it can actually shatter solid material on the micro level. And then there's radial waves that are more of a lower energy form, in the millijoules of 90 to 120 millijoules is what I typically use. And I'll talk a little bit more about that. But that's what our focus today will be on, is more the low energy radial waves. What does that type of a sound wave do? What is the effect of that kind of a radial wave? We see a reduction in swelling. We see improvement in lymphatic drainage. It's really coming down to improving blood flow. With that, we get relaxation of the tissue. In general, the tissue looks better. It improves comfort, meaning any kind of treatment in the office where I might have swelling and discomfort, the use of something like these radial waves improves the healing time, improves the comfort in the patient. And this is not a painful treatment whatsoever. At the same time, when we're getting that lymphatic drainage, we're also reducing toxins in the tissue. We're improving the wound healing response. And there's some really interesting things that I'll talk a little bit more about that is a little bit more subjective. And I think that there'll be some really cool research that will confirm some of the other effects that we might be seeing with this acoustic wave treatment, and more focused for me on the Z-Wave. The Z-Wave is FDA cleared for the temporary improvement of cellulite, and we will talk a little bit more about that. So what's happening within the handpiece, what's happening in the device, is this is a magnetically driven device. There's other types of acoustic wave devices on the market. I have used pretty much all of them. And my go-to in the practice without question is the Z-Wave. And what's happening is we have these electromagnetic coils that are alternating. Okay, so we have an alternating magnetic current that actually drives a projectile. So as there's a alteration in the current, that current in that alternating field of energy drives the projectile against the metal pin on the tip. And what we have is a fixed applicator head that is hit by the projectile. And what that does is creates the acoustic wave. So that sound wave spreads from that tip, and we have a range of energies that can be delivered based on the speed of the projectile. And we'll talk about that. So we've got some factors that are pretty simple to modify, but at the same time, it just goes back to some very simple physics. So we think about the amount of force that we want to achieve. So our variables are, okay, what is the mass of the projectile? Because that projectile will be moving back and forth. And how fast is that projectile moving? The take home, which is pretty simple, is the Z-Wave device has a very large projectile. So it has a larger projectile, which equates to a larger mass. So as a comparison, the projectile that is in the Z-Wave handpiece in the applicator weighs 0.6 grams, and the average projectile in competitive devices are 0.1 gram. So a much smaller, much lighter projectile. So keeping it very simple, if we're trying to deliver a certain amount of force with a larger projectile, we don't need to get it moving quite as quickly. So it's not as fast in acceleration, which translates into better comfort and also bigger forces that are available, meaning we could potentially elevate that acceleration and deliver more force. So essentially we have a bigger hammer available. The other thing is the projectile will be moving and rebounding off of the metal tip. And then the metal tip is actually where that energy is going to be transmitted radially. The tip that's on the Z-Wave applicator is larger than competitive devices. So we have a larger spot size. So what does that mean? That translates significantly into comfort and also depth of penetration, meaning we can get deeper energy and we also have a larger spot size, just like very similar to a laser spot. As the laser spot, if you're focusing higher amounts of energy on a smaller spot, it becomes more uncomfortable because that energy is more focused. If we increase that spot size, then the comfort is higher. And I can tell you firsthand feedback from patients, because I've used different devices that have smaller spot sizes, that larger spot size makes a big difference in comfort, especially if you're treating some delicate areas, which we'll talk about a little bit later. So on this slide, I've highlighted the idea of the Z-Wave Q. So the Z-Wave Q is the latest and greatest iteration of the Z-Wave. And what is different about it is it's cooled with water. So as the treatment is progressing, the water is recirculating and cooling the device. What does that do? How is that relevant? Because sometimes, it's not, you've all experienced it. Manufacturers will come out with a new update and you kind of think, okay, is it really worth it? What's the big deal about this? With this device, the Z-Wave Q, where we have a big advantage is because it's water cooled, it can run indefinitely, meaning you get many more pulses without having to pause treatment. So with the Z-Wave Pro, you would be doing treatment, and as it would start to overheat, you would have to pause your treatment and you could switch to a different handpiece and use that handpiece. And if that started to overheat, you could switch back. So it just depended on how many pulses you were needing to do. So with the Z-Wave Q, because it's water cooled, you can do very long treatments if needed, and you don't have to worry about that. The other thing is it's a quieter device. So the Q is for quiet because the water cooling allows for the device to have a more muffled sound. You still can hear it, but I would say my guesstimate is it's at least 50% quieter. And at the same time, the Z-Wave Pro, having that noise to me is not a significant disadvantage. Some people don't like the noise. I actually kind of like being able to hear the device because it's an opportunity in office. This is a little pearl. Anytime that Z-Wave is running, which is very frequent in our office, I let the patient know. I say, that is the Z-Wave that is running. That's the fat cracker. We use that with all our body contouring because it gets better results and makes the whole experience more comfortable for the patient. Their eyes light up, they can hear it, and it gives an opportunity. So to me, the disadvantage is noise. So if the advantage is you can use the noise to your advantage. But I will say that the Z-Wave Q is a beautiful balance because getting to do longer treatments and also having the comfort of knowing that you don't have that noise is actually a benefit. It's easier to clean the Z-Wave Q because there doesn't tend to be as much oil involved. But the cleansing of the Z-Wave Pro, as long as you're consistent with it, is not a big deal. But I will say it does check the box with the new Z-Wave Q that we have a comfort improvement as far as sound, less overheating, and easier and cleaner procedure overall. But they're both overall pretty cool. So this is going to just show that radial wave. So this is in slow motion, and that's with the silicone cup removed from the actual tip so that we can see really close to the applicator tip. And you can see those waves moving through the skin surface, and they spread radial down into the tissue. And we get a penetration into the tissue of 3.5 to 4 centimeters if needed. So just like a laser, we have a lot of control over how that wave is delivered, meaning if we have a higher frequency, so if we're at 18 to 20 hertz, it's going to be a little bit more superficial. As we decrease the frequency, we'll get deeper penetration of the energy. And at the end of the day, the treatment itself, when it's being performed in the office, is very fast. So this is not a treatment that takes a long time. I'd say your average treatment is about 3 to 4 minutes. If you're doing some longer extended treatments, it might end up coming to around 10 to 12 minutes. But in the grand scheme of things in office, the treatment itself is actually very, very quick, which is great. Because for us, it's typically an add-on to treatment. It can be done as a standalone treatment, and I'll talk more about that. But for the most part, this is something that is added to a lot of the treatments we do. So having a quick expedited treatment is helpful. So as I said earlier, the FDA clearance is for temporary improvement of cellulite. I'll preface it and be straightforward. There is no home run for cellulite. There's no holy grail. I know we're working on it, and there's lots of different modalities. The take home is really simple. Cellulite is very complicated, and there's a lot of issues happening at the same time. We have, as you can see, a bulging of the fat cells. We have some fibrosis of those fibroseptic networks, those septi between the globules of a fat compartment. And we also have skin quality issues often on the surface. And often there's an issue with detoxification in some patients, meaning it's a localized issue related largely because of the lack of blood flow or a disruption in blood flow. So there's a lot of different things going on. And what I found over the years is the best result that we can achieve with cellulite is through combining treatments, meaning trying to combine different therapies together so that we can get the best result possible. And what I would say is if it's a lower grade of cellulite, the type of cellulite that when someone lays down, it looks much better. I always joke that if we could all go around life just laying down on a gurney, we'd all look fabulous and there'd be much less demand for cellulite treatment. But when you stand up, and it exacerbates the cellulite, but it's improved when it's laying down, those cases typically you're going to be able to make a bigger improvement. If it's still visible when they're laying down, then it's going to be a little bit more complicated. This is just showing a series after a series of 10 treatments with acoustic wave therapy. And this is showing on the thigh, and it's showing the change looking at the liquid crystal contact thermography. And what you can see is improved blood flow. And this is many weeks after the 10th treatment. So it's not immediately after treatment. So there is a sustained result that we see as far as blood flow. And I can tell you after doing aggressive treatments to both the neck, the chin, the body, there's a definite change in blood flow, reduction in swelling, and improvement in overall lymphatic drainage. And all of those things are beneficial to improving cellulite. I do think that we get some longer lasting potential improvement on fat when we're actually doing something in addition to acoustic wave to the fat, whether we're delivering energy, whether we're using cryolipolysis, whether we're even doing dietary modification. This is something that I like to include or encourage patients to look at when they're doing any kind of weight loss with me. Because when I have a patient and we're doing body contouring, I want to make sure they're going to get the best result. And if they have more of an issue related to weight loss, which in my definition is if someone has 20 pounds or more to lose, they're really more of a weight loss candidate. I don't mind treating them with the various devices for body or treating cellulite, as long as they're doing something concurrently to lose weight. If they have less than 20 pounds, then I consider them a good candidate. But we don't want to present these treatments as a substitute for weight loss when it's needed. Overall improvement in blood flow accounts for a lot of what we see, but we do have this physical and mechanical effect on the tissue, which also feels pretty good, meaning this isn't a painful treatment. So patients really like the way it feels. These are some examples of some cellulite treatment. Again, no home run, but I do feel like this is a tool that can help the other procedures that you're doing, and it can be done as a standalone cellulite treatment. And something like that, we charge very minimally. We only charge $99 if we're doing cellulite, and let them know that they're going to be doing a series of weekly treatments. They can even do it twice a week if they want to. And they're going to see steady improvement that will continue to last, but it's not permanent. So they'll kind of want to maintain it. But as a general rule, we're using this as an adjunct to other therapies versus a standalone treatment. And your cost per treatment will vary from area to area, but literally most treatments, even when you're treating bilaterally on a patient, will take under 15 minutes. And there's no consumable other than a little gel or oil. I do like using a very minimal amount of coconut oil because it works really nice. It's nice to have on the skin at the end. Usually it has a slight smell that reminds people of Jamaica or maybe Hawaii, and we're all itching for that travel time now. So anything I can do to kind of emulate that in the practice is going to enhance the experience a little bit. So when I talk about enhancing the experience, these are all the body devices that I have in the office. I actually have a few that aren't on there, but these are the main go-to devices that we're using day in and day out. And combining Z-Wave is a big part of what I'm doing with these procedures. And for the treatment itself, it is bundled in with their package, with their treatment. And I am absolutely not the cheapest in town. I'm not Walmart. I strive to be more of a Nordstrom or Neiman Marcus. But having this bundled in, it's all about getting the absolute best result. And I'm convinced from years of experience, for multiple reasons, that it's invaluable, meaning to have acoustic wave as part of the treatment can make all the difference in not just the result, but a responder versus a non-responder. And I'll talk a little bit about that. But any kind of non-surgical fat reduction treatment or any treatment that involves tissue heating is an application that makes sense for using Z-Wave. Any post-surgical treatment, even treatments on scars, can be done post-tattoo removal. There's a lot of amazing applications. Essentially, anything that you can think of where you want to increase the wound healing response, improve blood flow, enhance reduction of edema, all of those things, this is something that can be used for that. There's also an ancillary benefit on the physical therapy side. Acoustic wave is used a lot for helping with inflammation and pain reduction. So I'll often have patients where we might be treating an area, doing some body shaping, and then they comment about how, their back pain has improved and how they've noticed other aches and pains feel better. So that's an ancillary benefit, or another way you can actually use it as a tool depending on your practice, but it definitely has an effect on localized pain and inflammation. I used it yesterday. I had a patient that I did a beautiful lip augmentation on. She looks fantastic. There's no visible lump or bump. When she stretches out the lip, really, I know you've had them maybe on the facial side where they distort their lip to a point where, it's not anything remotely natural and you never make that expression. And you could palpate a small little area that had a very minimal nodularity. Instead of trying to inject something or doing a physical massage, it takes just a few moments to use the Z-Wave to do an acoustic massage. So there's endless ways that this can be used in the practice. And I literally am using it every day. And I do have I have the Z-Wave Pro and the Z-Wave Q. So we're using it all the time. And really, when it comes down to it, the way that I look at this device is it really is like the Swiss Army knife of devices. I really don't have another device that I use in so many different ways with so many different patients and so many applications. Um, you don't have to use it for multiple things, but you have that opportunity with the device. And if you're only using it for one thing and using it over and over, that's great. But it's definitely something that has multiple uses in the practice. The way this was introduced to me was its application with tool sculpting. So this is Dr. Christopher Zachary doing a video showing and demonstrating the treatment with the Z-Wave Pro. And the idea is one side, the patient's right side, had the Z-Wave, and the left side did not post cool sculpting. And this has been confirmed and repeated with other sites, and also there's many white papers relating to it. And I can tell you from my own experience and the other doctors that have done the white papers, I haven't been involved with a white paper on this subject, but I'm friends with many of them. This is legitimate data. It's very powerful data. And the take home is simple. Although some of that initial work was done with cool sculpting, this has been done with radio frequency technology. It's been done with multiple body shaping devices. And the message is really simple. The amount of fat reduction seen with adding acoustic wave increases the overall amount of fat reduced. Okay, so that's only one component. That's about result. And at the end of the day, we all want the best result for our patient. The second component to it is a reduction in post-treatment swelling, a reduction in post-treatment pain, a reduction in post-treatment edema. And when I say that, I mean over a long term. And what I will say is I also feel like it speeds up the result, meaning patients will see the result quicker. Now, whether that's because of the increase in reduction of fat or whether it's because of the swelling resolving quicker, but I can tell you in my practice over the last 5 years, I think for cool sculpting patients, I might have prescribed Neurontin once, if that. I think once. It might have been even more than 5 years ago. I just don't deal with post-treatment pain like I did before I used the Z-Wave. And this overlaps on a lot of other subdermal treatments. So this is an example. This was a combination of M-Sculpt with Vanquish. We add the Z-Wave to that protocol. And what I can tell you is where this is really relevant is not even just in delivering the result, but it's also in taking a patient that potentially could be a responder, a non-responder, and making them a responder. Meaning, when you've put together your treatment plan for that patient, you feel really good about what they've done, and they have done their treatment, and you look at the result, and it's just not what you would expect based on what you've done. To me, that's a non-responder. And what I will say consistently over the years, when I've had a patient that was a non-responder, we looked back and for some reason that patient did not get Z-Wave treatment. And I will tell you, I've taken patients where we've done a treatment, where I saw this a lot was with radio frequency. Patients that did radio frequency and did not receive Z-Wave, when we added the Z-Wave, all of a sudden, they come back and we do a follow-up treatment, add the Z-Wave, they come back and they'd lost an inch, 2 inches. And I do very accurate 3D photography for both the face and the body. So when I talk about a reduction, I'm down to the 0.1 inches typically. So we can really track progress. The 3D camera that I use for the body is called the Staiku. S as in Sam, T, Y as in yellow, K, U, Staiku. And it's a phenomenal tool for anybody that's doing a lot of body work. But if I was going to choose a tool, I'd take the Z-Wave before the Staiku though. But as far as overall in a body practice, having really accurate photography is really important. And also on the chin. So this is an example of Cool Mini for the chin. I did do a little bit of some volume correction in the posterior mandible, but the Cool Mini chin applicator, I find that's one that's brilliant with Z-Wave. There's a significant difference. We really speed up the result when we combine the acoustic wave with the Cool Mini. It's relevant for all of the Cool Sculpting applicators, and it's not just Cool Sculpting, because as you saw, I've got a lot of different devices, and we incorporate acoustic wave with all of them. Uh, Steven's a friend of mine. That's why I'm showing his quote. He's a big believer in acoustic wave. Lots of speaking and presenting relating to body contouring devices. So I like representing people that I've met and I know that it's legitimate. This is a big part of his practice. It's a big part of my practice. And frankly, I was shocked. Many years, it might have been 4 or 5 years ago, I did a presentation relating to acoustic wave, and there were all these Cool Sculpting users in the audience, and I asked how many were using acoustic wave with their Cool Sculpting, and there was one hand that went up, and I was like, oh my gosh, we've got all these white papers that show the difference that it makes, enhancing fat reduction by up to 30% compared to without acoustic wave, and reducing post-treatment swelling and discomfort for patients is so crucial, because you want patients to come back. You want them to come back. And, Dr. Steve Diane has done work on this. If a patient has a really painful experience, 25 to 30% of those patients will just disappear. They will never come back. Even if they get more bruising with the procedure that they expected, they will disappear. So we want to do everything to mitigate that, because as providers, I think a lot of us feel like, oh, if we get a little bruise, it's not a big deal. If it's a little painful, it's okay, because it's worth it. For some naive patients, someone that's new to this, that can be a game, that can end it for them, meaning they lose faith, and it's almost a traumatic experience. So we want to do everything to reduce that risk. Amy also is a big believer in a combination of Cool Sculpting and Z-Wave. And again, these are people that I know that are using it boots on the ground clinically, and it's a really important part of their practice. As you can see, I'm using it with all of these different devices. So whenever I do something subdermally with the chin, whether we're doing transcutaneous energy to the chin, we're doing the body, I'm going to incorporate acoustic wave because it's going to get us a better result. And at the same time and time again, we're trying to avoid that kryptonite. We don't want kryptonite. What's kryptonite? It's something that makes you weak. And what makes you weak? A patient that gets a bad result, a poor result, an outcome that you don't expect, or they have a poor experience. So for me, anything that we can do to improve that experience, to reduce the risk of having kryptonite in the practice. There's nothing more frustrating than me doing a consult and putting together what I think is the best treatment plan possible, having the patient start that process and not see what we'd expect. And what I can say is definitively, acoustic wave in combination with what I'm doing has reduced that incidence significantly. So again, we've got this Swiss Army knife. And what does that mean? There's a lot of different applications. So, a lot of patients might not talk about it as much, but I do have in my practice about 30% of my on the cosmetic side is male. So I do treat a lot of male patients. So the topic of not just erectile function, but I also do some hormone replacement, do a lot of hormone testing. So it's more about vitality, and a lot of the things that patients are doing for their face, they're really trying to turn back the time on their face to be a younger version of themselves. And often they want the same thing for their body, but it's not exclusive to wanting to feel good too. So it's this balance of wanting to look good, wanting to feel good. And what I've said over the years, and the reason why sexual wellness is still a part of the practice, is I am convinced if you do something to improve someone's sex life, they become the most committed patient, period. Meaning, if you can improve that aspect to their life, they become that much more committed, and then they're going to end up doing other things in the practice, and it's a lifelong relationship. So what do we have that relates to Z-Wave? Erectile function is not just about function, but it's also about appearance and change over time. It's also about the goals of the patient. So it can be everything from function to enlargement. It could be related to not just appearance, but also sensation, because all of these things can change as we age. And we have lots of tools. And what I would say is, the thing that's really interesting about acoustic wave is that's a tool that we can use that not only can be used in isolation as a standalone treatment for erectile function, but it can often be combined with some of the other therapies that you might consider having in the practice relating to erectile function. The thing that's really interesting with this type of treatment and type of niche area within the practice is when patients see an improvement, they want more. So it's not a one and done kind of treatment. And even when patients see an improvement, they are going to want to do maintenance and continue with their treatment plan. So it's really a win-win. So going back to some of the mechanisms of acoustic wave, a lot of this has to do with increasing blood flow. So when you increase blood flow, you're going to improve overall function of the tissue, but you're also going to improve skin quality, any kind of fibrotic tissue, any kind of issue relating to blood flow is going to be helped by acoustic wave. The other thing is, if someone's using something like PRP or other growth factors in the practice, this is something that can be done in conjunction with that. And it's going to have a synergy where it's a 1 + 1 = 3. So a bigger outcome, bigger result, and also very comfortable. As a standalone treatment, acoustic wave is incredibly comfortable. It can be delegated. It's a very easy procedure. And for the most part, what you have to think about is the main effect is blood flow, but we are delivering energy. So when we're delivering energy through a radial wave, to a certain extent, the more energy, the better. We're not producing excessive heat. It's not a heat-driven procedure. So essentially, we have the opportunity to deliver lots of energy in a very safe way. And anybody that's seen me lecture before, at the end of the day, almost all the devices that we use day in, day out are all about delivering energy to a specific target as safely and as comfortably as possible, period. Very simple. So what we have with acoustic wave is a fast treatment that's very comfortable, very consistent, and we have the ability, especially with the Z-Wave Q, because you've got unlimited pulses, to deliver a lot of energy in a single treatment. And I want to clarify too, when I say unlimited pulses, it's because it's water cooled. So if you want to deliver 10,000 pulses, you can consistently. With the Z-Wave Pro, you can still deliver 10,000 pulses. The difference will be that it's very likely that one of the hand pieces will get too warm from the procedure, and you'll have to switch to another hand piece to finish the procedure. So it's not that inconvenient. You can absolutely do a great treatment with the Z-Wave Pro. From a convenience standpoint as a user, the combination of it being a quieter treatment, I do feel like it might be a little bit more comfortable, just slightly. Then the Z-Wave Q is a definite advantage. And I've got big time there, which kind of relates to the procedure we're doing. But I will use it immediately after doing a PRP injection if I am doing that procedure. If you're doing any kind of filler or fat transfer or anything like that, it can also be used immediately post with that. But the majority of patients will do a standalone treatment with acoustic wave. What I want you to think about with the procedure is you don't have to move the handpiece a lot. Basically, you can have the handpiece static and deliver a significant number of pulses. And just think of the neurovascular supply to the penis. So the main neurovascular bundle is superior to at 12 o'clock, right at the insertion of the shaft of the penis and the pubic bone. So that's kind of one of the money spots. And you can just go circumferential around the entire penis right onto the pelvic region. And think about blood supply. So that goes all the way to the perineum, because we're dealing with prostatic flow, prostatic supply. But you can feel free to email me if you have any other specific questions, and I can also help with that. So typically that will be done on a regular basis, and then patients will go into maintenance. But there is no discomfort with it. It's a really miraculous treatment. It's rare that a patient doesn't see an improvement with one treatment. Basically, I do want to include just a few really quick COVID considerations. So I'm sure a lot of people are doing these things. In the practice, it's become kind of a staple. Patients are reassured. We're really enhancing cleaning procedures using UVC light at night. I really like using stabilized hypochlorous acid. Brand name is Laserson. I really like using those. That product is really nice on the skin. It's really easy to spray and use. It does come in a gel as well. Having testing options and an open discussion. This is important. You can't control what your staff do outside of work, but just really having a discussion about expectations and a hope that your staff is also mindful about what they're doing outside of the office, because obviously we're bringing that back into the office, and we want to keep both the staff and the patients that we're seeing every day really really healthy, and that's incredibly important. So again, improved outcomes, improved comfort. This is a fast treatment, very, very versatile. And I'd say this is a big differentiator still to this day. Even with all of this evidence, there's still a lot of people that are not incorporating acoustic wave as part of their body practice. So whenever we're doing a consult, anybody calls in on the phone and we're talking about, what differentiates us? What is it that we're going to do to credential us versus someone else? We always talk about acoustic wave is part of the treatment. We include that. It's going to increase the result, improve the result, and it's going to help reduce any kind of post-treatment swelling and discomfort. That's really reassuring to the patient. And I guarantee that there's going to be times where patients are shopping around and that'll be something that they're not hearing from other people. And then it becomes less about the commodity and more about your expertise as a provider. My email, just in case you need it, is dr_JD_McCoy, JDMCCOY @mac.com, MAC.com. And my Instagram handle is at Contour Medical. Feel free to reach out if you have other questions. I will be able to answer some questions now during our Q&A period, but I hope this helped a little bit, and I wish everyone warm cheers and good health. Everything is heading in the right direction. I believe that, and I'm confident that we're going to keep really, really busy and keep people looking and feeling their best.
Great, we do have some questions already. So first one, how long does the average treatment take?
So I'd say the average treatment time takes about 5 to 6 minutes. If you're doing a more elaborate cellulite treatment where you might be treating a larger area, then you could be at 10 to 15 minutes. With the erectile function cases, those treatments take anywhere from 7 to 8 minutes to about 12 minutes, depending on the pulses. So if someone's got more severe erectile function issues, they'll need more pulses. So it's pretty simple because you're setting the frequency and the energy. So the frequency is determining how many pulses per second. So the more pulses you're delivering, the longer it's going to take. I will say if you're bringing a patient in for a standalone treatment, you really kind of, the way I describe it, you kind of have to add a little bit of fluff because, as far as their setup and how, and giving them some post-treatment instructions and just talking about the procedure a little bit, because even if they're only spending, $100, $500, $750, when they're doing that kind of a treatment, you don't want them to come in, do 4 minutes, and then they're out the door. So it almost feels like you have to add a little bit to it. So I hope that helps a little bit. As far as, there's other questions, correct?
Yes.
Okay.
Can Z-Wave be used on tattooed skin?
Yes, it absolutely can. In fact, post-tattoo removal, if you're doing laser tattoo removal, you can actually use the Z-Wave to improve and speed up lymphatic drainage of the region. It can speed up the resolution of the breakdown of the pigment. So it can actually be used as an adjunct to tattoo. It's definitely, as I said, the versatility of this device is pretty remarkable.
Are there any consumables involved with this machine? And if so, how often do you have to replace them?
So as far as consumable, day-to-day use is really more about just applying a little ultrasound gel, if you prefer that, or a little oil. And I use typically a coconut oil or a massage oil. So that's what it comes down to. There's silicone tips that are provided, but those are minimal, meaning we're talking just a few dollars. And depending on the device, you get millions of pulses out of the handpiece. Or it's rated with the two hand pieces, so that on the Z-Wave Pro it will require a refurbishment, but that's after extensive use. So the take home is, if you've done 1 million pulses with the device, you've more than outweighed the cost of having to do the maintenance on the handpiece.
Can you talk about settings and protocols for the treatment?
Yeah, so depending on most areas that are being treated, I'm using as low as 60 millijoules, and the highest typically is around 120 millijoules. I would say the majority of treatments are done at 90 millijoules. I don't know if there's much to it, but I feel like for the penile treatment, so if you're doing any erectile function treatment, I think there's an advantage to varying the frequency more than anything. The energy is one factor, so I would typically use anywhere from 90 to 120 millijoules for erectile function. But where I'll vary the frequency, I usually will start the treatment at 16 hertz, and then I will raise the frequency to around 20 hertz. So kind of like very similar to how we deliver energy when we're doing light-based treatments. You kind of work from deep to superficial as a general rule. So when you're at a lower frequency, the energy is going to be delivered a little bit deeper. So you're getting deeper penetration of energy. And then by layering it at a higher frequency, you're going to deliver the energy a little bit more superficially. I feel like it makes a difference. I don't believe there's any white paper to support that, but I do feel like doing that is great. As far as the number of pulses, typically if I'm treating on the body an area the size of about 2 hands, I like to deliver about 3,500 pulses. I will treat the chin, and think about it, your hand, one hand, so you're at typically around 15 to 1,600 pulses. If you're treating like a very small area, you're going to need far less pulses, so maybe 200, 300 pulses. Where we get into the larger pulses is with the ED treatment. So most patients, if it's their first treatment, I like doing ideally around 7,500 pulses. And that will be in multiple locations. Again, if someone's really curious about that, I can send a diagram with, because the whole lecture wasn't just about that, but I'm happy to provide a few more details as far as maybe a diagram that shows the locations. But the focus is really thinking about the blood flow and delivering that energy evenly around the entire area being treated. But I'll do up to 10,000 plus pulses if I need to, and I definitely prefer the Z-Wave Q for those longer treatments.
Is the Z-Wave only for body work, or are there any facial applications?
So in my office, I use it primarily on the body whenever we're doing any kind of chin treatment or jaw treatment. So let's say we're doing an RF treatment to the lower face, we will use it there if our goal is debulking or if there is some significant swelling. But I don't do a lot of facial application, but to me, it actually makes sense that there probably is some validity to using it more on the face. I even think there's probably some evidence that it might be valuable to use in the scalp, even if you're doing any kind of hair restoration or stimulatory treatments with, for example, PRP in the hair. And one of the things I neglected to mention earlier, one of the theories I've heard from, and the name of the European doctor is escaping me, but one of the effects that they think may be happening with radial waves, with acoustic wave, is when we're getting this rapid mechanical radial wave going through the tissue, potentially it could actually be stimulating platelet degranulation. So there is a possibility that we're actually getting some growth factor release from the platelets in the area that we're treating. So some of the effect might be blood flow, but it might actually be growth factor release from the platelets, much like we concentrate the platelets in PRP or PRF and transfer that, and we want those platelets to degranulate to deliver their growth factors. So some of that might actually be happening with this acoustic wave treatment. So potentially that has other applications. I think the key to that is figuring out what's the exact frequency, if there is an exact frequency in energy form, as far as fluence, that perpetuates that. So I think that's an interesting area. And obviously that would have facial application, scalp application. The thing I'd caution is if you're over a bony prominence, if it's thin tissue, if you're on bone, then you don't want to be at really high energies. And I would have the device set at a higher frequency, like 20 to 22 hertz, because then the energy is more superficial, which will make it more comfortable. And that's going to get you to your target, because your target is most likely not bone.
Do you use Z-Wave standalone for cellulite, or do you combine it with other technologies?
So in the office, it's typically as a combination. So if a patient is doing cellulite treatment, if a patient is doing any kind of body contouring, we use it as a combination. We do have some patients that do it more as just a standalone cellulite treatment, but that's a pretty small percentage. I'd say it typically gets diverted in that direction if it's a patient with a budgetary concern. But for me, it's always about setting expectation and making sure they're a good candidate. So like I said, if they're, when they lay down, if it makes the cellulite better, then I know that they're going to see some improvement. And the price point on that kind of a treatment is typically $99 to $199 a treatment. And I want them doing frequent treatments if possible. So it spaces out the payment for patients. So if they can't afford a bigger, more robust package that might include other treatments, it seems to work nicely for that. But it absolutely does help for that indication as a standalone. But I'd say you really want to set the patient expectation.
How many treatments are required for improvement in erectile dysfunction?
So that's going to vary largely based on the severity of their erectile function. So what I would say is most patients will notice an improvement right after their first treatment. So especially if you have someone that already has reasonable function, They're responsive to something like tadalafil, and they'll notice a difference typically right after their first treatment. Someone that's not as responsive to those medications may take a series of 3 treatments before they'll notice more change with that. Part of it too is the time factor involved with not just improving the blood flow, but our goal is to get a little bit of angiogenesis. So if we get a little bit of wound healing and persistent improvement in blood flow, like that liquid chromatography showed, those images were after a series of 10 treatments. But I feel like most patients after about 3 will see a difference. And that's got really high patient satisfaction, meaning patients will see an improvement, and it's largely related to severity. I do encourage combination therapy with something like I do a compounded tadalafil sublingual lozenge, which is very affordable. And also I can send information if people are interested in it. I didn't include it in the presentation, but we can talk a little bit about tadalafil, and I combine apomorphine, which is not controlled like morphine. It's a different molecule metabolite. But those have great success, and patients are very happy with that.
Do you use the Z-Wave immediately post-lipo procedure or wait a week or so? And how many treatments post-lipo would you do?
So it can be done immediately post-lipo. I use it immediate. So if I do a subdermal treatment, immediately post-lipo, it is something that you can do on a weekly basis. But what you'll do, if it's immediately post-lipo, it'll help remove excess tumescent. It'll help reduce swelling. I do feel like one of the reasons why we see an enhanced fat reduction in the tissue compared to, I don't think there's a study that I know of that looks at lipo with or without Z-Wave treatment. But what you're doing is there will be some mechanically damaged fat cells from the lipo. So fat cells that were not removed through the actual suction that would be kind of borderline, they're damaged, but fat is very resilient. It wants to survive inherently. So the acoustic wave will help potentially destroy some of those fat cells that were kind of on borderline. So it's a way to reinitiate a micro trauma that can actually enhance the result of the lipo. But it absolutely helps with reducing contour defects, improving reduction in swelling and post-treatment discomfort.
How long do the results last after erectile dysfunction treatment?
So typically, if someone does a treatment and they notice improvement, it's going to last for many weeks. It's kind of one of those things, though, if someone's just starting, the amount of time that they'll notice an improvement will vary. It could be as much as a few days to a couple weeks. As someone has done more sustained treatment, what ends up happening is they get more sustained improvement in blood flow. As some of the other white papers that have looked at that, you can get sustained improvement for months. Again, though, many patients, they're going to like the result. They're going to like the improvement. This is a totally non-invasive treatment, other than someone having to be comfortable about, having that area being treated. But it's totally non-invasive. There's no injections. So it's something that patients like the result, and they're not going to be very apprehensive about continuing therapy. So I encourage patients to do a bigger package of treatment, and then you can do a maintenance treatment, and you can have a lower price point potentially for that once they've already done their series.
We're butting up against our time, but we do have one question left, so I wanted to make sure that we got to it. And it's,
Sure,
if I wanted to bundle Z-Wave with another treatment or therapy, what would you recommend we pair with it?
I bundle it with almost everything. So absolutely, if you're doing cryolipolysis. But when I'm including it with the treatment, because I've found consistently that this is going to make the existing treatment work even better. So where we use it the most, I would say with all of the body contouring tools. So if you're ever heating the tissue, whether it's for tightening or fat reduction, cryolipolysis if you're doing lipo, those are the big ones. And standalone for erectile function, and then obviously for cellulite, those would be the home runs as far as where I would apply the Z-Wave in a mindful way to both be a differentiator, but also encourage patients to do more treatment because they're going to see better result.
Thank you so much, Dr. McCoy, for doing this with us today.
Well, I appreciate it. I think it went well. They were very thoughtful questions. And again, if there's something that we didn't cover that anybody wants to reach out, I'm very happy to email you personally, or I'll check my messages on Instagram. And I hope everyone has a great day.
Thanks so much. Everybody have a good day.
Thank you.